Actually, I want to ask with this cooperation between the government and private healthcare providers, I wanted to know on whether the diagnosis-related group payment model, how is it going to be implemented and what stage is it at?
Right. Predicted this soalan is cukup masnya soalan. I just prepared it. So let me just say this, yeah. In the private sector, the private DRG implementation, okay, is governed under the newly formed, what we call it, Joint Ministerial Committee on Private Sector Cost. So it's a joint ministerial committee, particularly Minister of Finance, or rather specifically Second Finance Minister MK2, with myself as the YBMK Minister of Health. So that is, that's how it's going to be governed. Yeah. Now the phase implementation, we know DRG, as you may or may not know, can be simple and can be as complex. It all depends on the diagnosis-related group according to the ICB, the International Classification of Diseases, 11, yeah, or even 10. Now, most importantly, how this is going to be implemented. Surely, at its completion or at its most complex, system, it will certainly take time. So, how we suggest to do it is to do it incrementally. At the phase 1, the phase of implementation of DRG is planned to be linked to the it will go with easier cases, and then we go to the complex cases as we move along throughout 2026. And to just remind you, this DRG is now related to this thing called base product of MHIT. Yeah, paling saya cakap Melayu. Paling cakap bahasa Melayu. This is the MHIT, the Medical Health Insurance Takaful insurance product. So it is somehow linked to the DRG. Why? Because before DRG, payment to your services in the private hospital is paid through pay for services. Pay for service. You pay as to the volume of test curve, numbers of test curve, procedures curve, whatever. There's no kind of a classification, a grouping, the groupers of how complex particular disease. There's no such thing. You just pay as for the service you are rendered by the specialist or by the hospital. Yeah. But now with DRG, what you get to see is that there is a way to standardize payment, okay, where they get to be grouped together and a bundle kind of case, and bundle kind of approach. Then what you are paying is actually pay for what I like to call pay for outcome. Now I stress on the importance of the overarching principle of getting a value-based healthcare. Now with DRG, you have a semblance of getting to value-based because you are paying for outcome. The more efficient you are, the lesser become, less complication there are, So you get to be, if you are efficient, you're not wasteful or whatever, by way of whatever. So this is why the DRG is linked to this thing of the payment through base insurance thing called MHIT. So the MHIT is a novel product. There are many other insurances already out there, but this is our introduction, which is a combination of us, MOH, Bank Negara, MOF, So we work together to produce this. In a way, why we are nudging the people to subscribe to this, because we want them to shift from paying out of pocket, which is very inflationary, I can tell you. It is inflationary, as opposed to buying insurance product, which will be the element of prepaid and pool, and you get better outcome and better efficiency in the sense of health outcome. So this is why MHIT is linked to DRG, and I wouldn't go further than that. I would like to talk about our Rakan TKM, but that's for another day.